The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. Today we're going to talk about supplements. Many supplements out there. Are they good? Are they bad? Are they useful? We're going to talk to someone that has considered this for a number of years, Dr. David DeRose. He is a physician. He's practiced for over 20 years. And he has a specialty in internal medicine and also preventive medicine. You've worked at various lifestyle centers, different places around America, and also some work internationally. You have a ministry called Compass Health, compasshealth.net, and so all points of the compass. I mean, you cover all kinds of different things, and you have that website that has a lot of the things we're going to talk about, and also a lot of other subjects right there, so people can take a closer look.
That's right. There'll be some overviews of the material that we cover today on the website, as well as a lot of other information that I know our viewers will enjoy. And there's no charge for any of those free resources, of course.
So talk to us about, supplements, nutritive supplements, all different types of supplements. You have stores full of them. Are they good? Are they bad? Help us with this.
Well, one of the ways I like to look at this, Don, is you take a supplement, you take a compound if you've got a deficiency of that compound. What most people are doing today, instead of having that philosophy, they're taking the philosophy of, well, I've heard this about something, I've heard that about something, and then I'm taking this as a result. Now, I'm not going to say every supplement is used just for deficiency, but especially when we speak about basic nutrients, that's usually one of the first questions we want to ask.
So is there a deficiency? And if there is, then we look. But if there's not, then don't worry about it so much.
That's one approach. Second thing, if you've got specific problems, and there's some scientific rationale or a literature base that would say this may respond to a certain supplement, then by all means, this may be worthy of consideration.
I wish we could take some calls today and have people actually tell us about, the different supplements they are taking and whatnot. But we kind of just pulled those working in the studio. Some are taking, multivitamins, some are taking glucosamine, some are taking, various things we've heard. So we might deal with some of those. What should we beware of when we're looking at supplements?
Well, I'll tell you the first thing to beware of. You mentioned multivitamins, and that's a combination product. I don't have as big a problem with that. We'll talk about multivitamins in a minute, but many companies are out there trying to put together their proprietary supplement, and this is true with multivitamins. Everyone's got their special mix of things, and they're trying to promote to varying degrees why you should buy theirs. I'm always very concerned, Don, when someone is trying to promote some proprietary blend of things and trying to charge people top dollar for it.
So anytime it looks like they're trying to make money off something, beware.
Well, let's be realistic. There's going to be no supplements sold where they're trying to lose money, right?
Well, probably that's correct.
Yeah, but here's the point. Let's say you've got a specific problem. Let's take arthritis, because you mentioned the glucosamine, chondroitin, whatever. Well, what do you think the research shows of all the supplements that are out there for arthritis? From my perspective, what I've seen out there, the most compelling evidence suggests that glucosamine is helpful. Okay, so if I stick a bunch of glucosamine in a pill and also put some chondroitin and MSM and some other things, I'm not saying any of those other things are not helpful. But what I am saying is many times only one or a few of the compounds in these multiple supplements may be efficacious.
Okay, helpful.
Helpful, that's right. Actually helpful in doing what you want it to do. So when I'm taking care of a patient, what I tend to do is I say, look, you've got joint pain. Let's look, first of all, at why you've got the joint pain.
Mm-hmm.
Okay? Because if there's something you're doing,
Yeah, like chopping 600 cords of wood a day.
that's right.
That could cause some joint pain.
That could cause some joint pain. And maybe you just need to cut back to 500. Right?
Right.
Okay. Or maybe you need to ice the joint after doing all the chopping. Yes. By the same token, if you weigh 500 pounds and you're having knee pain, I'm not saying that the chondroitin has no value.
But look at the big problem.
Look at the big problem. And then it's fine to use a supplement.
Sure.
By the way, of those supplements, the glucosamine is the one that seems to have the most beneficial effect. In fact, the studies I've seen, it's the only one that really has compelling data that I've seen. Now, I'm not going to tell you that I've seen every single study done on these compounds, but this has been kind of a view of many in the alternative and complementary medicine area, that glucosamine is really the supplement that seems to stand head and shoulders above the others. It's not to say there's no value to the others, but the chondroitin, since we mentioned it, a lot of us are very worried about. And some people say, well, sure, DeRose is worried about it because it's an animal product and he's this vegetarian. Well, I was at a conference probably 5 years ago now. Big, a high-profile rheumatologist at one of these big medical centers, and she was sharing with this audience of ostensibly non-vegetarians, even though I and my wife were there, that she was worried about all of the animal products that were on the market because of the mad cow situation and cattle that were being funneled in different directions. She was worried about where glucosamine was, where chondroitin was coming from, not glucosamine, where chondroitin was coming from.
Now, on your website, compasshealth.net, do you have a list of things that you've researched? I mean, that'd be a very helpful list.
There's a number of subjects that we've researched now. All the things that we're going to be talking about as far as supplements, because this is kind of a free-flowing dialogue, will not necessarily be there. But we've got a lot of information that covers a variety of supplements and other conditions.
So you've seen some supplements that are, like you say, efficacious or they have a good effect. You see some that are not, like saw, palmetto, you say is helpful, and so is beta, what is it?
Sitosterol.
Sitosterol for working with prostate enlargement.
Yeah, there is data that suggests that men who have prostate enlargement, that the saw palmetto appears to be helpful for many of them. And even more impressive from the data I've seen is a compound called beta-sitosterol. It's found in a number of plant products, but this naturally occurring plant sterol actually has cholesterol-lowering properties, as well as evidence that it can actually help with prostate enlargement and the symptoms of prostate enlargement, at least.
So whatever the claims, if they're trying to make a lot of money and say theirs is the best, always take that with a grain of salt or beware. And then secondly, you're not saying that all are bad, but look at the major problem first before you go to a supplement.
Yes, and look at the specific constituents of the supplement, okay? So like I'm saying, if there's good data out there that seems to suggest saw palmetto may be helpful, well, try the saw palmetto for a period of time, and ideally do it working with your physician. More and more physicians are open to incorporating some of these complementary therapies because their patients are using it. They've got to do it. They've got to get interested in it. And medical education is encouraging physicians to at least ask their patients about these things. Because the other big issue, Don, we've got to admit it, is these supplements can interact with other medications that people are taking.
And there are some that are actually dangerous. I mean, you say on your website that excess selenium can be a real problem, and then others as well.
I mean, selenium's a good example. We need selenium, which is a micronutrient, for optimal immune function. And in many people's minds, the old adage, if a little's good, a lot is better. But the problem with selenium is when you take excessive amounts, it tends to suppress immune function. Another example is vitamin B6.
Okay.
Vitamin B6, also known as pyridoxine.
Pyridoxine.
That's
yeah.
right. If you're pyridoxine deficient, you can get a neuropathy. You can have nerve problems.
So it's good to have enough of it.
It's good to have enough. But if you take too much, you know what you can get?
Same thing. Neuropathy.
You're exactly right. You can get a neuropathy from too much.
Too much or too little?
Too little.
So just let the body regulate it and don't you mess around with it.
Well, yes, that's great if you've got a good diet that you're on, Don. I mean, I can say that to you because you know, I had lunch with you today and I saw what you ate.
Yeah, it was pretty good.
It was.
That's what you ate too.
That's what I ate too. But a lot of people, sure, they're not getting a balanced diet, and so the knee-jerk response is what?
Take a little bit more.
Yeah, take a multivitamin.
Mm-hmm.
And what I would suggest is what we're learning is that's a dangerous strategy to follow. Because more and more things that we have listed on those multivitamins, we're getting concerned about. I'll give you a good example. It's the vitamin A compounds.
Vitamin A, because they're not water soluble.
They're not water soluble, that's true.
So they don't just pass through the system.
They don't just pass through the system, but there's a bigger problem.
What is it?
Whether you look at vitamin A, the preformed vitamin A, you know, the form that the body uses, or you look at beta-carotene, which is what we call a precursor, it's something the body converts into active vitamin A. Whether either of those compounds did look at some of the initial work on cancer, when we looked at that as a medical community, we saw that people who were eating more beta-carotene had less cancer.
Mm-hmm.
So what was the thought? The thought was, well,
more is good.
More is good. And so they did some actual clinical studies where they gave people at high risk of cancer, like smokers, they gave them extra beta-carotene. And by and large, you know what happened?
What?
They got more cancer.
Because?
What appears to be happening is beta-carotene is one of this family of retinoids, one of this family of compounds. When you just take one, it overwhelms the body's ability to utilize a whole host of other good related compounds like zeaxanthin and lutein and lycopene, and a number of these other compounds that are very helpful to the body.
So if you overdo it on one thing, it decreases the ability for the body to use the other things it really needs to fight off cancer.
That's exactly right. And we've seen this if you look at drug and nutrient interactions, if you look at nutrient and nutrient interactions. You start increasing one thing and you increase your requirements for something else, or you totally overwhelm the body's ability to use things of that compound.
Because of the interaction.
That's right. It's like the way analogy I like, Don, is you got here to 3ABN partly by driving on the freeway, didn't you?
Yeah, I try to stay on it most of the time.
Okay, that's good. And while you were driving on that freeway has a finite capacity. In other words, probably maybe holiday weekends and things. At some places, as you're going through major cities on those interstates, you may be bumper to bumper and may even be stopping. Is that right?
Unfortunately, that's correct.
Okay. So the freeways in our nation can only accommodate so much traffic.
Mm-hmm.
It's the same with the transport mechanisms in the body. And so when I look at people's supplements, this is amazing. Because they say, I'm taking this pill for my joints, you know, this one for my cholesterol, you know, this one for my diabetes, this one to put more hair on my head. By the way, that's one that I'm not using, Don, if you were wondering. Okay, so you've got all these supplements, and I look at these supplements.
Not enough room on the highway for all of them.
But Don, I go down the list. And this one has, you know, 10,000 units of beta-carotene, and this one has 20,000, and you add all this stuff up, and they're getting all kinds of stuff that they're not even aware of. They thought, well, I was just taking this for my joints.
Right.
So what the point of all this is we've got to look at what we're doing. If you've got a problem, say, talk with your doctor, get the information, read up about it, go to my website, whatever it is you're going to do, get the different information sources you can, tap into them, and say, what is a reasonable strategy, ideally, that I can plan together with my healthcare professional?
And less is more.
Less is often more.
We're talking with Dr. David DeRose. We're talking about supplements. I mean, the analogy you just gave of the freeway is an apt one. Maybe it'd be good for you to get out your list of supplements and write them down, and in the second half of the program, take an inventory. Join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Luddington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Luddington have been featured on 3ABN, and in this booklet, They present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. David DeRose about supplements, and he closed by giving us an illustration of having so many cars on a freeway, or maybe like juggling. You can only juggle so many things, and if you add more and more supplements, you may not have room for the very needful things your body requires to fight off disease and to keep your immune system healthy. Is that a okay way to summarize what we've been saying?
No, I think it's great, because the idea is God has given us certain capacities. He's given us insights into how to care for our bodies. It's in His Word. It comes from an understanding, an enlightened and a spiritually directed understanding of physiology. And we tend to short circuit, to try to take shortcuts, and we really end up getting short circuits that cause problems.
So these, general lifestyle principles, many times people want to hear good news about their bad habits. If they could be overweight and just take a couple pills and feel like they're better, they probably want to do that. You ever encounter that?
Well, of course, Don. I mean, think about it. People are always looking for some easy way out. But since we're talking about overweight, I just want to make sure that our viewers don't get the wrong idea.
Okay.
In that illustration I shared earlier in the program.
About the car going on the
No,
highway.
not about the car, about the 500-pound individual who's got arthritis.
Yeah, okay.
I don't tell someone, look, we're not going to help you until you lose 300 pounds. We're not going to give you any medication. We're not going to give you any supplements. We're not going to do anything for you. But, Don, here's what I'm getting at. Look at it this way.
Okay.
If someone is not focused on the underlying problem, then I'm not really helping them address the problem if I'm just giving them a drug or a supplement. Now, let me say it this way. The American public, as well as the public at large in the world, is recognizing that medications are often not all they've been cracked out to be. Right?
Mm-hmm. Oh, yeah. They're starting to get a grip on that.
Yeah, we're getting a grip on it. And people are gravitating away from them. And oftentimes, though, what they're gravitating to are supplements because they're natural.
But there's problems there, too.
There are problems there, too. We've talked about some of the things that can be problems in excess. But even more so, Don, think about it. If something's not helping, if it's doing you no good,
why take it?
Why take it? Let me tell you about a woman who talked with me just recently. We'll call her Harriet. Of course, that's not her real name. 5 foot 2 inches tall, weighed about 215 pounds.
That's a little high.
It is a little high. But you know what her problems were?
Her problem was being overweight.
Well, that's one of her problems.
Okay.
But she had high blood pressure. She had cholesterol problems. She had a family history of breast cancer that she was concerned about. And when I talked with her, she was taking like 50 to 100 supplements to address these concerns.
Whoa. What else did she do during the day?
I don't know what else she did.
That's quite a bit of supplements.
Yeah.
Oh.
And she wanted to go through each of them with me. Okay? And actually, I was interested to do it because what I realized was going on is she was focused all her energy to try to figure out things. She couldn't even figure out all that she was taking. They say that's an extreme case, but she was not focused on a good exercise program, a weight reduction program, which would have lowered her risk of breast cancer. It would have lowered her cholesterol. It would have helped address her diabetes and blood pressure problems.
Oh, man, she must have brought a suitcase.
Well, do you see the point, though?
I see the point.
And so we're trying to have this balance. And so on one hand, yes, supplements have a role if they're prescribed for a specific reason, where there's some compelling medical evidence or at least some compelling medical theory. There's some support for it, or there's an actual deficiency. If not, you're asking for trouble. If nothing more than depleting your bank account, it could be something much, much worse.
So let's talk about some of these supplements. What about, you said glucosamine is good for osteoarthritis?
There is evidence that glucosamine is definitely helpful in osteoarthritis. I mentioned Harriet, just an interesting aside. She was making sure her brother was taking not only glucosamine, but chondroitin and a bunch of other things purported to have joint benefit, and it turned out her brother didn't have any joint symptoms. Okay.
So it doesn't do any good to take something if you don't need it.
There's no rationale to do that because that's not something that's been looked at, and it doesn't even make sense to treat a problem that's not there. These are not things that generally speak about doing prophylactically. I'll give you an example, though. Prophylaxis or preventive, one that there is some evidence for is garlic.
Garlic.
Low-dose garlic actually has been shown to decrease the risk of developing colds, taking some garlic on a daily basis.
So garlic supplements are okay?
So there's, in that context, if you were just on a plane flight and you were up all night, you didn't get enough sleep.
Sounds familiar.
Can you imagine a scenario like that? And you said, you know, there are all these people coughing on the plane. I think I'm going to, you know, take a couple of garlic capsules this morning.
Slam a few of them back, yeah.
Yeah, I mean, there's some rationale for doing that. But to take 2 garlics the rest of your life, and especially if you're on blood-thinning medications, the garlic may tip the balance against them. It's an excellent place to speak about drug interactions if you want to go that direction.
Well, let's go that direction. What about drug interactions?
Well, drug interactions are very important, and they're especially critical with drugs with a narrow therapeutic window.
Meaning?
Good question. Therapeutic window. Just, you got windows in your house, right?
A few.
Yeah. I was actually in a house the other day that had no windows in one of their main rooms. It was another building that had been converted into a home. Interesting, isn't it? But this house, actually, that I'm speaking about, my house or your house, has a window. And that window can only open so far, right?
Right.
Have you ever been in a house, maybe you have one yourself, that has like a little half-size window that can just open a little way?
Mm-hmm. In the bathroom.
Okay, in the bathroom. So this window just opens up a little bit.
Right.
You can't get much through it, can you?
No.
There isn't much room to play with.
That's correct.
When we use that term, and I know you know this being a health professional, but for the benefit of our listeners, narrow therapeutic window means there's not much room to get excess of a drug or too little of the drug. Take an example, a blood thinner like Coumadin.
Mm-hmm.
You get too little, it's not going to do the job of preventing the stroke or
clots.
The blood clot or the heart valve, the mechanical valve you've got. It's not going to keep it from clogging up, right? If you get too little. If you get too much, what's going to happen?
It's going to cause too much thinning.
That's right. And you could bleed to death, right, in an extreme situation.
So it needs to have within that narrow window.
Yeah. So drugs with a narrow therapeutic window, if you're taking one of those, if you're taking a Lanoxin, if you're taking a drug for HIV, if you're taking a blood thinner, if you've had a kidney transplant or a liver transplant, if you're taking any of these critical drugs that have to be kept in a narrow range, do not start taking a supplement unless you talk with your physician. Because even some of these, quote, good supplements, I've given you an example. Garlic does have some benefits in the anti-infectious arena. Right. But if you're also on Coumadin, that may not be the thing that you should be taking.
So talk with someone who knows how all these things interact.
Especially if you're on some of these critical drugs that operate in a narrow range. Now, that's not the majority of drugs, but I've given you some examples, and if you've got a question, ask your doctor if this drug is very critical in the range that it operates in.
What about barley green and all those derivatives that are supposedly high in these, green parts of the plants?
Well, you know, plants are loaded with phytochemicals, and these are plant chemicals. Many of these plant chemicals have health-giving properties. And so I don't feel any burden to say there's no value in these things, because there is some value. But the question is, why is a person taking it? What is it doing for them? And are there better ways to accomplish the same ends? If they say, look I like barley green, I like how it tastes, I like how it looks, you know, whatever it is, and I've been feeling better since I've been taking it, well, I do not have a great burden to say they can't use that. But by the same token, if someone under false pretenses, uses a pretext to get me to speak at a barley green convention, it actually happened to me once, Don.
Did you go?
I didn't know it was a barley green convention. They lined me up for an out-of-town presentation, and I turn up at the big barley green conference. I'm their keynote speaker.
Whoa.
Yeah.
Did they give you a green jacket?
No, but Don, here's what's going on. We're trying to market all these products when really what we most need is to eat more fruits and whole grains and vegetables. Don, look at it this way. Think about it for a minute.
I'm thinking.
I don't know what's in barley green, okay? I don't have the whole list in front of me, okay?
Probably.
I've seen lists before of what's in it,
right.
But I can't recite it for you right now. But you know what? No matter what's in barley green, there's a bunch of other hot plant compounds. They're not hot now, but they will be next year or the year after.
Better go to those conventions too if you get on that bandwagon.
That's right. But you know what's even better? Why not start eating the variety of plant foods that God's given us?
Mm-hmm.
You know what one of the hot compounds is today?
I have no idea.
Lycopene.
Oh, I have heard about that.
Lutein. Okay.
Pycnogenol.
You know what? Let me just take the example of lycopene.
Okay, let's go.
Good for prostate health, for example.
Right.
Do you know what? Before lycopene was delivered, you know what my grandfather was doing?
He was eating lycopene.
He was. He was born in Italy. He was eating lots of tomato products, and he never had a prostate problem. Mm-hmm. Now, just what would have happened if he had focused on getting all his nutrients from supplements?
Wouldn't have worked.
It wouldn't have worked.
So you can't really recapture the fountain of youth either here. If you that's something people sometimes try and say.
Yeah, you know, one more classic example. This just comes to mind. Medical student. I was a medical student years ago. I actually had hair back then, and don't look so so astonished.
I think I probably. Well, I might have recognized you.
Yeah, you may have recognized me. But I was doing some health screening with a team, and we found this interesting fellow. He did worse on the stress test than the 80-year-old women were doing. He was in his 40s. And when we sat this guy down and started to counsel with him, he started telling us, I'm very conscientious about my health. He started going down the list of all the supplements he was taking.
Ooh.
You see the point?
Mm-hmm. He didn't do the basics. He was depending on the bottles and so the basics.
That's right.
So the message then today is, hey, there's some benefits to many of these different things, but don't forget the basics. And then if there is some kind of deficiency, then it's viable to fill it. But don't add too much to the plate. All those different things we talked about.
I don't think you needed this presentation. You got it all figured out, it sounds like.
Well, thank you for what you've done on the website. Thank you for the supporting material here. And if people have questions, they can look at this on the website there, compasshealth.net. And thank you for taking time out of your busy schedule to spend a little time with us here also on Health for a Lifetime. And thank you for joining us on Health for a Lifetime. Look, you can take stock now. You can take out that list, take out your pad of paper and your pencil, write down all those supplements that maybe you're taking and others are taking. Then ask yourself the question, do I really need these? Am I doing the basics? Go to Dr. DeRosa's website, compasshealth.net. Look at the supporting materials there. And, you know, do the very minimum in terms of supplements. Do the basics first, and then if you need something, of course, there's all kinds of things that you could look at to add. Be careful about your decisions, and we hope you have health that lasts for a lifetime.